to the power of one. Women's health is so important. Dr. Kathleen Christophe is here today so we can have a conversation just to talk about what women go through and how they can seek some natural remedy. Welcome to the show, Dr. Christophe. Dr. Christophe, please tell me where you work and what you specialize in.
Hi, Ms. Nelson. I currently am providing services at Cbim, which stands for Community Volunteers in Medicine, and this is in Westchester, PA. And what it is basically a very unique healthcare setting where we're able to provide free healthcare services to those who have no insurance. And my specialty is gynecology.
Okay, all right. So gynecology, how important is it for women to get their yearly Pap smear? But I think that has changed over the years where women don't need to get a Pap smear every year now, but they still need to have their yearly exam, correct?
That is very correct. So going to the gynecologist is critical for preventative care and maintenance. Many women only see us for healthcare services and probably see us more so than their other primary care providers like internal medicine or family medicine. So we do offer a lot of just preventative medicine care as well, making sure your vaccinations are up to date, making sure your other screenings are up to date, like your colon cancer risk, checking for thyroid hormone levels and so forth. So it is very important that you go. In addition, you want to have just a regular exam. In addition to your heart and lungs, we make sure your breast exam is normal. We teach you how to do your own self-breast exams. And if indicated, a pelvic exam is needed, we also perform that as well.
Okay. Now, as for me, since we're having this conversation, and it's a good conversation, it's a good thing. So for me, doing my own breast exam is a little alarming sometimes because of the type of breast that I have. So that can be scary. So I do go every year. Every year I'm faithful, but I do wait because of the type of breast that I have. So do you find that with some women, if they have certain type of breast, they may feel different things during the course of a month?
Well, absolutely. Part of the changes that occur within the menstrual cycles can involve breast swelling or breast tenderness. And women who have more dense breasts tend to sometimes have to get further follow-up imaging, which can cause some anxiety.
Yes, a lot of anxiety.
Yes, but luckily we do have the technology where we can offer it. We are kind of moving more towards even MRIs, and we do perform MRIs for those who have denser breasts. But as far as you also mentioned, as far as the Pap Smear Screening before, yes, the Pap Smear Screening is critical. There are some changes with how we're doing the screening. If you're from the age of 21 to 29 years of age, we just do a simple Pap smear, which we're all pretty familiar with, where we use the brush to examine the cells in the outer portion of the cervix, and the endo brush, which examines the cells and collects cells from the inner portion of the cervix. So we do that. If it's normal, then you come back every 3 years for another one. One of the major key changes that we have found is from the 30 to 65 year age group. That is the group where, with the newer technologies, we've been able to streamline and have more simple yet more efficient means of following our patients. So there are actually 3 modalities in evaluating cervical cancer screening from the 30 to 65-year-old age group. We can do now just primary Hpv testing, and Hpv stands for the human papillomavirus, where we evaluate for the high-risk types. And that can be done in the office or self-collected. The second option is also to do the routine Pap smear along with the HPV testing, and that's called co-testing. And the third option is just a routine Pap, as we're all familiar with, the cervical cytology, which is done every 3 years. So that is acceptable, the Pap smear, but the preferred methods are either the primary HPV screening or the co-testing.
Okay.
So basically what that has allowed us to do is to streamline a more simple and efficient process. And why is that? Because we actually have the technology now to do what's called Hpv genotyping. So we can actually identify which HPV virus we're dealing with and also risk stratify where or how the patient's risk is by giving an actual number or percentage. And that will tell us, well, which algorithm we should follow. Can we just survey that patient, follow them, have them come back in a year or 3 years? Or do we need to be more proactive with either colposcopy, which is using a magnifying machine and evaluating the cervix more closely and doing biopsies as necessary? Or do we even need to go further for immediate treatment and actually do an excisional treatment, hopefully removing all the areas that are affected by the HPV, which can be curative as well?
Okay. So let's speak a little bit about menstrual cycle. I know that many women experience different symptoms around their menstrual cycle. What could be some of the symptoms before, during, and after a woman has her menstrual cycle monthly?
Well, majority of the significant changes that occur with a woman during their menstrual cycle occur due to the variations of the fluctuations in the hormones. So estrogen and progesterone are really the two key hormones that are involved in the menstrual cycle. There's over 120% fluctuations in estrogen, and there's over 1,200% change in progesterone. So that's quite a bit.
Right.
And some women seem to be more susceptible or more vulnerable to those fluctuations than others. And in turn, they may have symptoms consistent with what's called premenstrual disorder. Now, what is key about that is the symptoms with premenstrual disorder can be both emotional and physical. And in order to make a diagnosis, you need one of each category. And basically, they can fall under a list of categories, which can give like more of a psychiatric picture. Or is there something physically going on with this patient? Does she have anemia? Does she have a thyroid disease? And so forth.
So you're going to break down for us PMS and maybe Pmdd?
Correct. And Pmdd is actually the severe form of PMS. So actually more of the debilitating aspect of PMS, which is more on a psychological aspect of it, or more basis, even though you can still have the physical complaints. But the Pmdd more or less is so severe and debilitating that it has a significant impact in the way the patient interacts on a social level, at work, school, or home, their relationships, and so forth. But let's take a look at the different symptoms. In order to make a diagnostic criteria for premenstrual syndrome, you need at least one of the affective or emotional symptoms and one somatic or physical symptoms. So the list of the emotional symptoms can be angry outbursts, anxiety, confusion, depression, irritability, and social withdrawal. And as you see, those can fall along a whole list of differential for many other diagnoses. And the physical symptoms is abdominal bloating, breast tenderness and swelling, headache, which, you wonder if the patient actually has a migraine, joint or muscle pain, swelling of the extremities, or weight gain. But the key thing here in determining if we're dealing with PMS is that you want to be sure that there's a pattern involved. So typically we will have the patient fill out a questionnaire of symptoms and see where they rate them and if they've had them persistent for 2 to 3 cycles. And if they are persistent within 2 to 3 cycles within the luteal phase, and that is the portion of the menstrual cycle right after ovulation, if those symptoms appear to be persistent and are at least 5 days before the onset of menses and seem to get better and resolve at the start of menses or a few days into menses, then we have a pretty good diagnosis for premenstrual syndrome. Now for PMDD, premenstrual dysphoric disorder, again, this is a complication of premenstrual disorder. And essentially what we're dealing with here is more of the psychiatric symptoms, which seem to be more persistent, although you still have some of the physical complaints. So as it says here, you must have at least 5 symptoms present in the final week before the onset of menses. And again, start to improve within a few days after menses and become minimal or absent in the week post-menses. But you need one of the following symptoms have to be present. So marked affective lability. So you're talking about significant mood swings. Patient is crying and feeling sad most of the time or all the time. Increased sensitivity to rejection. So probably not a good time to ask your loved one, what do you think about my new hairdo or my new dress? Marked irritability or anger or increased interpersonal conflict. So, you know, we all hear the stories and the jokes about the husband saying, oh my God, I know when this time of the month is here. And it's like, I'm dealing with a monster. Marked depressed mood, feeling hopeless, self-deprecating thoughts. And those are classic for just simple depression, major depression syndrome. Marked anxiety, tension, or feelings of anxiety being keyed up or on edge. And that is classic for anxiety disorder. So you have to have at least one of those. And the whole key is it's really debilitating. You just can't seem to get along with anyone. You just hate life and you're just feeling not yourself. You're feeling sad. You're not really feeling good. And one of more of the following symptoms here must be present to reach a total of 5 symptoms when combined with the symptoms from what we just read. So decreased interest in usual activities, work, school, friends, or hobbies. And that includes even intercourse, so decreased libido. Subjective difficulty in concentration, lethargy, so you're feeling tired, you just don't really feel like doing much of anything. You don't have that energy. Not eating like you normally do. You can either overeat or not eat much, or you can crave specific foods. So a lot of women say, you know, I want to eat chocolate, or there's certain things that they like to eat around that particular time. Hypersomnia or insomnia. So you might sleep too much or sleep too little. You may feel overwhelmed or out of control. You just feel like you can't get a handle on what's going on in your life, and everything kind of seems to be out of your control. And then again, as I said, you can still have the physical symptoms because again, this is a complication of PMS, not a totally separate disease. So you still can have the breast tenderness or swelling, your joint or muscle pain, the sensation of bloating, or the weight gain. So again, we want to do a menstrual diary and see that there's a pattern. So that is the major issue here. Do we see a persistent pattern? Is it occurring in the luteal phase or that time right after ovulation, just prior to the onset of menses? If we see that within 2 to 3 cycles, and more than likely this is what we're dealing with.
Now, can a woman who is in her menopause stage or has been in menopause stage for a long time, can she still experience all of these symptoms even though she does not receive a menstrual cycle every month?
Absolutely. Actually, There appears to be an association. So women who have PMS have an increased risk of having difficulty with the transition to menopause. There's increase in hot flashes. There is increased risk for depression, anxiety, and difficulties with similar difficulties that they found in PMS. With the psychological components can also manifest during that transition to menopause. So it is important for the gynecologist to discuss that with their patient, that, okay, even though, we're dealing with this now in your younger years, 20, 30, maybe 40, but just keep in mind, that it might be an issue later, which would prompt intervention to prevent that or decrease that chance.
Okay. It always amazes me that, like, I can feel the difference before my menstrual. It just amazes me that part of my body can affect my mental state. So I can feel myself, I'm like sleepy, irritable. Don't come near me, hubby. Not now. Today is just not the day. And that could last for like a week. I feel it though, but it's hard to turn off.
Yes, but more than likely, you probably feel better when menses comes around. When you actually, a few days into it, you start feeling more like yourself. What I would say is it's such a common thing, common issue. We currently say the literature has about 12% of women experience it. I would think that it's higher. I think that in society, most women have gotten accustomed to the idea of you're just not going to feel well during that time of the month, and you kind of push through and go along. But actually, again, it can have significant impact, and it is something to work on. So the first issue is we want to make sure that we're dealing with the right diagnosis, because there's so many other things that could be going on. Does this patient have a thyroid disorder? Is there a underlying psychiatric disorder, or can they be concurrent? You can have more than one thing happening at once. Is this anemia? They're just so fatigued that their blood count is low. Maybe their menses are too heavy, but they're also going through these emotional changes. So there's just so many things. And unfortunately, a lot of women, we don't bring it up to our gynecologist. What I would say, though, that there is a light at the end of the tunnel. There's a lot of interventions that can be done on a simple basis. First and foremost, like most illnesses, chronic disorders, lifestyle and diet is key. If we can really get a handle on, one, getting that regular exercise in. Exercise is so key. Not only does it elevate the endorphins, which make us feel better, these chemicals actually help alleviate the depression and anxiety, but they also alleviate fatigue. You can get a burst of energy just from exercise. You start to feel good about yourself. So the issues of the self-deprecating thoughts and just not feeling good and out of control, they're minimized just from exercise. So even doing 30 minutes of that a day can make such a huge impact. As far as diet, that's huge. So avoiding sugars, even though you may have those cravings, instead of getting the processed sweets like the chocolate bars or cookies, stick to the fruits. The berries, the raspberries, blueberries, blackberries, they have incredible antioxidants in them and other chemicals which help you feel better. They bind to the free radicals, which are little chemicals that our bodies make from processed foods and just the wear and tear of just being alive. And these cause the havoc that we have in our bodies. So these antioxidants actually bind them and help get rid of them in our bodies and make us feel better. And you have a better resolution in handling that craving, because with the natural sweets, like in fruits, they carry along fiber, and you don't feel like you constantly need to keep eating. you'll eat a certain amount and usually feel full faster. Vegetables, key, particularly the leafy vegetables. They are also critical with the fiber content and all the nutrients that they provide that help us feel better. There are studies that show that calcium supplementation, about 1,000 to 1,200 milligrams during that luteal phase, or at least about a week to 2 weeks during this period, may help. However, you can also get it from your vegetables and your dairy products and your yogurts. So just monitoring diet. I'm a firm proponent to herbs and natural herbs, and they provide so much for us. It's like free medicine that's been given to us. So I'm a big one for turmeric and ginger. Ginger has been noted, and there's well documentation about it relieving nausea and helping with menstrual cramps. So you can make some ginger tea and have it any time of the day. Turmeric is a powerful anti-inflammatory as well as ginger. And that has so many benefits. There are studies that have placed turmeric along Prozac, the antidepressant, and studied them for a 6-week period for patients taking both either or placebo. And they found that they both parties, the placebo and the turmeric recipients, both had alleviation of their depression. And obviously turmeric is less costly, more readily available, and with minimal side effects. So these are things that we could all do ourselves, which will promote the health, alleviate a lot of those symptoms that we go through during the PMS or even the PMDD, and help us get through that period.
Which can be really rough. So Dr. Christophe, please tell me again how people can utilize the services, the free services where you are, which I think is so crucial for those who cannot afford health insurance and those who cannot get health insurance. So please share that information with our viewers.
Yes, so CBIM, Community Volunteers in Medicine, is in Lawrence Drive in Westchester, Pennsylvania. They can, look it up on the internet, or they can actually, when they get that information, call or make an appointment. They have services on their website where you can actually put in your name. But it's a wonderful resource for patients, because those who have no insurance, even if you're undocumented, you can get health care, which is wonderful. If you end up being eligible for Medicare or Medicaid, they have social services available where they will help you get that and then refer you to where you can get health care. So they just won't push you out the door. They will assist you until you get the care that you need.
That's excellent. That is so excellent. And Doctor, I thank you so much for taking your time to help those in need who are not fortunate as you and I. That means a lot. You are truly a hero, and I thank you so much. Thank you so much for joining me today.
Oh, you're very welcome. It was a pleasure for me and an honor for me to be able to be in your broadcast. Thank you so much for asking.
Thank you for joining me today. It is extremely important, women, that you get your yearly physical. It is extremely important for you to stay healthy, eat healthy, and get your proper rest. Thank you for joining me today.